Good evening, everyone, and welcome to the Business of Aesthetics Expert Panel webinar session on the integrative medicine and aesthetics, merging hormone therapy, wellness, and beauty. I'm Don Adisha, and tonight's conversation is about bridging two worlds, the science of wellness and the art of aesthetics, to create more vibrant, long-lasting patient results. At Business of Aesthetics, our mission is simple. It's to help aesthetic professionals build practices that thrive by being found, trusted, and chosen. Tonight, you'll hear from two leaders who are redefining integrative care. You'll learn how hormone balance, lifestyle medicine, and aesthetic precision can work together to elevate results and loyalty. By the end of this hour, you'll walk away with proven frameworks for merging wellness and beauty in your practice. The conversation we are having tonight doesn't have to end in an hour. It continues every week on the Business of Aesthetics podcast. Our mission there is, of course, simple to bring you actionable business insights from industry leaders to bridge the gap between aesthetics and management. New episode drops every Tuesday. Just search for Business of Aesthetics podcast wherever you listen and be sure to subscribe. Now, here's something every practice owner really needs to start thinking about. The way patients find you online is changing fast. For years, ranking high on Google or running ads almost guaranteed visibility. But today, AI-driven tools like ChatGPT, Google's AI overviews, and voice assistants are giving patients instant answers. So, often before they even visit the website. That means the old model of just ranking on Google is just no longer enough. So, the real question is how do you make sure your practice is still the one patients trust and choose? The answer lies in becoming the authority AI recognizes. Build expert driven content, earn digital trust, and make every piece of your online presence reinforce your credibility. In this new world, success isn't just about being found, it's about being chosen and recommended by AI. So stay with us until the end because we've got something special for you, a free tool that can help you strengthen your online footprint. With that being said, let's get to know our panelists. So our first panelist, uh, Dr. Tanya Lawson, understands beauty from the inside out. As the founder of In Bloom Health and Med Spa, Dr. Tanya Lawson has spent nearly 2 decades helping patients achieve balance, vitality, and confidence through integrative medicine. With an advanced training from Harvard and the American Academy of Anti-Aging Medicine, she's a leader in bridging wellness and aesthetics. Tonight, she brings her expertise to show us how hormone health and personalized care can completely transform aesthetic outcomes. Dr. Tanya, thank you so much for being here with us this evening.
Thank you. I look forward to it.
Fantastic. Our next expert is shaping the future of integrative aesthetic medicine. Dr. Nicole Chattel founded Vibrant Health Naturopathic Medical Center and Thrive Med Spa, where she's built a model that merges wellness, aesthetics, and longevity. As a clinical educator and board member for the Aesthetic Medical Providers of NH, she helped countless practitioners understand that true beauty starts with health. Tonight, we'll share how functional insights can elevate every aesthetic outcome. Dr. Nicole, thank you so much for taking your time and being with us this evening.
Thank you. It's great to be here.
Okay. Now, with that being said, we'll take a quick look at what we'll be covering tonight. First, we'll talk about how wellness and aesthetics work together, how things like hormone therapy, lifestyle medicine, and can improve both outcomes and vitality. Then we'll look at how personalized treatment plans using each patient's history, labs, and goals. And then we'll also discuss ways to expand your offerings with wellness services like hormone optimization, weight management, and perhaps even skin health. Finally, we'll share proven ways to educate those patients so they understand the value of whole person care and stay for the loyal long term. Right. With that being said, we can move on to the main Q&A segment. So, my first question is for you, Dr. Tanya. Uh, in your experience, how does optimizing hormone balance and overall wellness influence aesthetic results and patient satisfaction?
Yeah, this is a great question because when patients come in for an aesthetic concern, I think in a traditional medical spa setting, a lot of times we're so focused on, what laser or what skincare or what injectable can we use to correct that. And all of that is appropriate. But if we go that one extra step and really start talking to patients about how they're feeling globally, I think we not only build more patient loyalty and satisfaction, but we also get a better outcome. So when patients come to my practice, if they don't feel good, if they're tired, they have weight gain, maybe they're going through perimenopause or menopause, and they just don't feel like themselves, I can perform aesthetic treatments on these patients, but I feel like no aesthetic treatment is really going to replace um, the fundamental things that help our body look its
Mhm.
best, right? If you're tired, you're stressed, you're not sleeping, that shows on your face, that shows in your skin. We know, for example, lack of sleep can affect our skin barrier, leading to dehydration. It's going to cause decreased elasticity, darker eye circles, puffiness, dullness. You just have this reduced glow. And there are real physical changes that happen in the skin when our body's not functioning at its best, right? Diet's
Mhm.
another great example. When we're eating an unhealthy diet, that shows in our skin. Maybe we're having more breakouts, maybe it's more oily, more dull. Where if we have a really nutrient-rich diet, right? These are the building blocks of our skin. We have enough protein. So I think we actually cannot speak about skin concerns without looking at some of these wellness concerns. And when we're looking even, more specifically at hormone changes and how those impact the skin, I mean, women who are going through perimenopause, menopause, that estrogen drop is really one of the core issues, right? It's going to make the skin more fragile with less collagen, less elastin. It's going to be more dehydrated. So some of these hormonal therapies and wellness treatments are really key in getting that skin to look younger and to behave younger, right? It's not just about how can we look young anymore. It's how can we actually slow aging or reverse aging by making the skin behave younger, which is a really, I think, awesome shift we've seen in the medical aesthetic field.
Yeah.
Dr. Nicole and I were both naturopathic doctors, and I've been one for almost 20 years. And I shared with you, we were speaking prior to the podcast. And
Yeah.
when I started naturopathic medicine, these ideas were considered fringe. They were alternative medicine. These were, you know, I'd say even other providers might have said this is quackery. Like you don't do IV therapy for skin health and for anti-aging. Well, back in 2006, I did. And, you know, so it's nice to see, I want to say the industry catch up, but a change in the industry where we're seeing this openness of, if these things work, we need to be utilizing them because that's what's best for our patients. And that's what
Mhm.
helps people feel their best. And being confident through aesthetics, right? You can look better, but if you feel good and look good, you can
Yeah.
take on the world, right? Like it's a whole new level because you can make
Absolutely.
people look good to a point, but if they're feeling tired, they carry themselves differently, right? It's just different. So I think you see a lot of vitality and vibrancy in
Mhm.
patients who embrace both of the inner and outer wellness treatments. Um, and you can just see in my practice even who's getting both types of treatments and maybe who's just getting aesthetic and doesn't really want to engage at any wellness treatments. And definitely the ones that are doing both they're just dynamite. It's amazing to
Fantastic.
watch the transformation.
Yes. Thank you very much for that very comprehensive answer, Dr. Tanya. And of course, those who take into consideration not just looking good, right? Actually feeling good, feeling better, and actually being younger instead of just looking younger.
Mhm.
That's a fascinating approach to aesthetics practices as well. Dr. Nicole, my next question is over to you. In your experience, how does hormone therapy, nutrition, and lifestyle medicine complement aesthetic treatments to create truly a transformative result for your patients?
So I think it's all about priming the cells to respond to the aesthetic treatments better too. In addition to feeling better, you're going to get a maximum result from the laser or the, when you stimulate the wound healing cascade and you're going to release all these growth factors. In effect, you want to have your cells respond really well to that. So most people, when they're getting an aesthetic treatment, they also are going to be, receiving some type of home skincare that they need to use. And if they don't, it's like your treatment isn't complete. You're doing them a disservice. You want to have them continue their results at home and maintain. And it's the same thing if you don't address from the inside out, but it's a major thing being missed in most aesthetic clinics. It's a missed opportunity. Having great skin is definitely a reflection of cellular health, and how patients respond and whether they have reactions post-treatment and have a tougher recovery can be a signal that their cells are not as healthy as they should be. And then when you prime your cells ahead of time with some supplemental treatments and post-treatment, you will be priming the bioreactor that stimulates the fibroblasts that will then build all the collagen for better signaling, and you have more, support and raw materials in place to get a greater result, 20 to 30% greater results when you have all of your bases covered with topical treatments and internal support. So estrogen is extremely important, and even like some low dose testosterone for collagen. When you go through menopause, you lose massive amounts of collagen all over your body, not just in your face, but in your bone and in other areas. And so also they're starting to finally recognize that the Women's Health Initiative study is not all that they claimed it to be. And hormones are actually a lot safer than they thought, and they can prolong women's lives for perhaps like 3 years or longer on average. So estrogen is a big one that can improve outcome with the right patient selection to prime those cells to respond. And then nutrition, like, do we think about what our body uses to build collagen and make sure that your client has that through their diet, and that they're not eating a ton of sugar so that they don't make, all the advanced glycation end products that's going to diminish their results over time. And these are like, these are all things that you can introduce to clients in little bites and handouts and things that, not like overwhelm them with information, but say, hey, here's my tips for how you can prime your body and prime your cells to respond to this treatment, so you get the best results, because I'm sure that's what you want.
Absolutely. And what I'm understanding is there is a very holistic approach to this, right? Combining hormone therapy, nutrition, lifestyle medicine, to make that real transformation instead of just a one-off result for the patient. I just wanted for you to expand a little bit on that nutrition aspect. You said, I mean, sugar isn't that great, but what is good? I mean, what are some good things
So
to recommend?
protein, but specifically collagen. A lot of people do drink collagen protein now, but collagen is special because it has actually peptides in it that stimulate fibroblasts and collagen that regular protein powders don't have. And then collagen protein powder also has, more of the amino acids that specifically are used for building collagen, obviously. So I love that they make some great collagen peptide, collagen protein powders. I add it to my one cup of coffee in the morning, and it gives me some extra protein, and it's creamy and it tastes delicious. So that's a wonderful thing to add in. I do strongly recommend that for most of my patients that are doing laser and regenerative treatments. And then, of course, vitamin C is absolutely necessary for collagen production, copper and zinc specifically. And some of our, a lot of our perimenopausal patients are iron deficient because their hormones are out of balance and they're having a lot of symptoms where they're losing a lot of blood. And so iron is also necessary for collagen production. So those patients might need iron, but we don't use iron in postmenopausal patients usually. So, those kind of things that can really affect how well someone responds to treatment.
Right. Thank you very much for that, Dr. Chattel. Now, back to you, Dr. Lawson. When designing an integrative treatment plan, right, what are the key factors or lab markers do you consider before recommending both hormone therapy and aesthetic procedures?
So when we're designing an integrative plan, really it starts with the initial consultation, right? The patient's going to fill out a very comprehensive intake form where it's not just asking about aesthetic concerns, but, do they have any medical conditions? What's their medical history? What supplements do they take? What medications are they on? Their allergies, and then lifestyle factors. How's their sleep? What are their stress levels like? Um, how's their digestion? How's their energy during the day? All of these things are really important to know, and they kind of paint the picture of the person who's coming in. And I like a lot of details, I think, as naturopathic doctors, because we've always been trained to look for the root cause of symptoms. We want to know all the symptoms and all of the things. Like, too much information is not a bad thing. And sometimes it can give you that little nugget or that little pearl that makes the difference in the right treatment and the diagnoses. I also do run full labs if you're wanting to be a candidate for hormone therapy. So I do CBC, CMP, lipid panel, A1C. I do a full thyroid panel that contains T3, T4, free T3, free T4, reverse T3, and thyroid antibodies. I don't think TSH is adequate when we're trying to assess the thyroid fully. When we talk about hormone therapy, a lot of times we're thinking about estrogen, progesterone, testosterone, but we can't forget about the importance of thyroid and how those female hormones impact the thyroid and vice versa. We also test for cortisol. Many times we're doing that as a salivary test as opposed to a blood work. Sometimes I'll run AM cortisol, but cortisol follows a diurnal pattern where it's really the highest in the morning and gradually decreases throughout the day. And it wouldn't be practical to capture that multiple times a day using blood work. And also sometimes the prick of the needle can falsely elevate cortisol, especially if you really don't like needles, and most people, don't. So we really want to get a more accurate snapshot using more functional medicine testing. Like Dr. Nicole mentioned, I also like to test for vitamin levels. I do think iron's extremely important, not just for energy, collagen, but hair loss. A lot of our women starting in their 40s, or even some of our GLP-1 patients have concerns of hair loss, and we really want to assess that from their iron status and correct it. When I'm correcting iron status, I'd like to look at ferritin levels. I like ferritin levels to be really over 50 for hair loss, over 40 for energy. These are just values that other doctors in the world shared with me that they got really great results. So it is a little bit anecdotal, but I do find that those levels are really good targets to aim for. So that's what I would do. And I think one thing to keep in mind, and maybe one challenge in testing, If someone's still cycling or is perimenopausal, obviously we're going to see fluctuations in the blood work
Mhm.
around
Mhm.
their hormone levels. Um, and perimenopause can have its own challenges because sometimes the levels go up and down. So depending where you're capturing the levels, you just want to be aware of there could be just when you think everything's figured out, things can change again. So regular testing is important. For my patients, I'm especially my perimenopausal patients, I might be testing them every 3 to 6 months.
Mm.
Patients who are maybe a little more stable or postmenopausal on a 6 months basis.
Right. Thank you, Dr. Tanya, for that.
Yeah, of course.
Yeah, absolutely. Just a curious follow-up question to that, with regards to, maybe a concern for our practice owners. How can they really manage the cost conversations with patients when, we are talking about lab testing? Like it might be a bit of a hesitant conversation.
So there's different ways that I've seen offices do labs. Some offices will do insurance, right?
Mm-hmm.
They'll use the patient's insurance to run the labs, and that's fine. We choose not to do that in our practice.
Mm-hmm.
Why? Well, one is a practical issue. I was trained in Canada, so I'm not as good as coding as the American doctors are. I know I could hire it out, but for me, it's not worth it just because we're a cash-based practice. So we
Right.
actually use a cash-based lab where, I've seen some labs come back when we've run things through insurance, where insurance says, "Hey, this isn't medically necessary. We're going to now charge the patient
Yeah.
$800,"
Yeah.
and we can run that same labs for like $100 out of pocket.
Yeah.
Most of my patients like to know, oh, okay, we can run these labs for $100. Let's just do that because I know the cost up front. It's reasonable. I mean, lab fees, I think, have come down a lot over the years. We're also seeing patients order their own labs. They
Right.
can now go online, run their own hormone panels, run their own vitamin levels. I have mixed feelings about it. I love the patient empowerment part of it. I think that's
Yeah.
awesome. And I think, for too long, patients sometimes had to fight with
Yeah.
doctors to get the labs that they really need it for their diagnosis because they know their body's the best. And if they're having symptoms, they're trying to advocate for what they think they need. And we had too many, I think, doctors being like, no, you don't need that. It's fine. So now I think that piece is really strong, but then we have patients putting their labs in Chat GPT or Googling, and sometimes they get right answers, but sometimes they don't. So it's nice just to, I think, have someone else still in the mix to help them
Absolutely.
navigate and to say, okay, you have these labs. This is what they say. And now these are the next best steps. And in
Yeah.
functional medicine, we get a lot of gray areas in labs, right? We know, okay, your vitamin D is 30 and above. Great, you're normal. But what levels do you need to be optimal and to reach optimal health? And
Yeah.
that's when I think someone who's trained in functional medicine or naturopathic medicine can come in and really help fine tune things for patients,
Right.
to make sure that they're going to get the results that they need so that it's more personalized.
Fantastic. Thank you very much for that, Dr. Lawson. And I agree completely with regards to, patients being empowered to get their lab test or even use ChatGPT to get a very thorough analysis or perhaps
Mhm.
just a second look, from that kind of perspective. But it's not decision that you should make just based off that, right? You should
Mhm.
always get a licensed practitioner, a licensed doctor decision with regards to
Mhm.
when it matters about your health, right?
For sure.
Absolutely. Absolutely. Thank you very much for that insight, Dr. Lawson. Um, moving to Dr. Chattel. Um, when you're designing a treatment plan, how do you balance lab insights, medical history, and aesthetic goals to create a protocol that's completely personalized?
So, definitely you need to start with what their top goals are, and the top symptoms, top goals. And so you identify, like you normally would, what are we gonna address first aesthetically? And then, let's just say they're not sleeping well and their hormones are out of balance. So we identify that. I I mean, just to be clear, I keep the time that I spend digging into their health and coming up with a plan and like educating them on their labs and my recommendations separate from any procedures that I'm doing. I think that's really important. And so like, you know, I do have people where I address their hormones and I'm have them on a pretty detailed holistic plan. And I see them for aesthetics and I see them at different time for, you know, both things. That is, you don't want to be in the middle of a procedure and then be changing their hormones up, you know, just for safety.
I agree.
So I think that's really important. If you're going to kind of do both, you need to kind of have like a system in place where this is just how it is. And we have like a space and a time set aside for that part of your care. So during that time, I do go over the medical history in depth and look at their risk factors and their lifestyle factors. And, you know, I'll address with them like, hey, you know, I know you've cut back on smoking, but if you continue to smoke, you're going to waste your money on this laser treatment.
Yeah.
You know, to a degree. So we address those lifestyle factors, sleep, nutrition, you know, and I put a plan together for them that's going to address their physical symptoms. And then I explain to them how it will also help them, you know, from the inside out in terms of their response to treatments and their long-term maintenance and long-term results. So yeah, so then there's like a 2-lane plan. I give them, you know, here's your procedure for your aesthetics, here's your outline plan for your aesthetic procedures, and this is the order we're going to do that in. Sometimes you do have to do labs first, you know, and a lot of times those patients are the ones that like see me first for the functional medicine part of things, and then we go into aesthetic procedures afterwards. And that's a great opportunity there because it is a little bit more of a challenge to, you know, have an aesthetic person coming in that's very much focused on what's going on the surface of their skin, and then have to kind of slowly introduce them to the idea of like, hey, you know, there's a lot going on inside that's contributing to this too, and try to motivate them to care about that more. But we'll do 2 foundations. We'll do the lane A, which is going to be their nutritional support, diet recommendations, supplements, sometimes hormones, and the lab testing first, obviously, and then the aesthetics plan for the procedures. And you monitor through the tools that you have in the office, the imaging, if you have more advanced imaging, measuring hydration, and the patient's reported improvements. And then of course you're tracking labs and symptoms. So having follow-ups appropriately, usually like, you know, 6 to 8 weeks later until you get things straightened out and get them on more of a maintenance plan.
Okay. Actually, I would like to get Dr. Tanya's opinion on this with regards to the conversion from aesthetics to functional medicine. Like, do you also have the same experience where, you know, patients who come in for aesthetic procedures are a bit more reluctant as compared to the other way around?
It just depends, I think, on the patient's age. I would say my patients who are 40 up tend to be a little more wanting of those services because they're the ones who are starting to have symptoms or starting to feel like, you know, they don't feel the same. I think, you know, my younger population, less so, like they want to come in, just have their Botox and, you know, they've got 20-year-old or 30-year-old skin, so they're not seeing some of these changes yet. Where, you know, we still can be really preventative with these younger ages, but sometimes too, like, you know, maybe they're just starting their careers, they have more limited budget. So I think there's a lot of different factors. Wellness patients, yes, I have, you know, some people will start as wellness and they're like, now I want to look as good as I feel. But then the relationships I build with my aesthetic patients, they're like, you know what, like I'm just really tired, or this is what's going on in my life. And that becomes a really great segue into like, we can run your labs and we can see what's going on. You're not sleeping, maybe it's your hormones, maybe it's your cortisol, maybe, you know, your mom has hypothyroid, you're feeling tired. Like, when was the last time your thyroid was checked? So there's ways we can approach the subject, I think, based on
Mm,
us just listening to the patients. Our patients tell us so much, but I think sometimes because in aesthetics, we do get closer to our patients and we're like, oh, where'd you go on the weekend? And oh, you who got married and show us pictures. But if we really listen to what they're telling us in terms of symptoms and follow through on that, that becomes us being really phenomenal clinicians. That becomes us doing right by our patients because they're giving us the little clues. And then it's for us to say, wait, hold on a second. Let's talk about that. Tell me more. And then
mm,
that becomes maybe one of your integrative medicine or functional medicine patients.
mhm.
And like Nicole, there is sometimes that challenge. Like, I might be doing a really quick, like 15-minute Botox treatment, and they're a wellness patient and they're saying, hey, like, this I'm doing this for my hormones, like, should I increase it more? And I don't even have their information in front of me.
Yeah.
Like, I'm doing my procedure and I know, the procedure I'm doing, but I don't have their labs in front of me. So usually I'll just redirect. I'll say, hey,
Right.
you know what? That's a really great question. Do we have an appointment on the books? Or, like, let's get a call set up. I don't have your labs in front of me and I want to look at all of that and listen to this more so that we make the next best steps. And usually I don't think actually I've gotten any pushback from patients about that. Like, they're like, oh, I should have even known, like, you don't have that right here. I don't see your computer, or, things like that. So, um, but I do think
Okay.
I wouldn't say that it's more or less. I think there's
Yeah.
opportunity on both sides. And then I
Mhm.
also think there's, some wellness patients that never want to become aesthetics and vice versa.
Right. Thank you very much for that, Dr. Tanya, as well as Dr. Nicole. Um, Before we move on, I would like to ask our audience members a small question. I'll run a little poll over here just to check the pulse. What's your biggest challenge with personalization in your practice? I'm going to launch it for 30 seconds and we'll see how that goes. Okay. Yep. Right. So I think we have a bit of a shy audience here. So no matter, with that being said, I would also like to, before we proceed, share a small message from our sponsor of this event. So yeah, I've got a gift from Equa Marketing for everyone here tonight, a complimentary one-on-one marketing strategy meeting. So here's the question Equa will be answering for you. When someone in your city searches Botox near me or Morpheus 8 costs or lip filler before and after, are you the practice that gets found, trusted, and chosen? Patient demand today is treatment specific and AI driven results are reshuffling who shows up first. So that's why your growth now depends on three things working together: be found, be trusted, and be chosen. In your session, an Equa strategist will do a live audit of your market position and give you a treatment level visibility plan designed to attract more qualified consults for injectables, lasers, or body contouring. It's immediately actionable, no fluff. These sessions fill up fast because our team does real pre work for every audit. So, if growth is on your radar this year, this 45-minute session will be the best use of your time. You may scan the QR code or use the link in chat. It takes under a minute to reserve and it's completely no obligation. You'll leave with a clear roadmap you can implement with us, your team, or in house. So go ahead and book your session now. So next time patients search for those treatments, they find you. Right. And here you go. So, back to you, Dr. Lawson. For aesthetic providers interested in adding wellness services like hormone therapy or nutrition programs, where do you suggest they begin? And what challenges should they be prepared for?
Yeah, I do get this question often, even just from colleagues saying, how can I learn about this? I want to implement this in my practice. And I would just say that you do need to be trained to provide these services, and it's not necessarily something that can happen really quickly. Like a weekend course, I don't think is sufficient to have full breadth of knowledge of all of these things, but it's like a good start. Um, Also, I would tell you, don't be scared to hire providers who do this day in, day out. Like you can bring a functional medicine doctor or a naturopathic doctor or maybe a functional medicine nutritionist on your team, right? You don't have to learn everything yourself. You can still be the aesthetic expert and work with other expert providers on your team. But if you yourself have a burning desire to do this, I would say be really cautious of quick fixes. There are some companies out there that promise you, like they have a computer system that you just plug in lab values, it'll spit out exactly what a patient needs. It's not that all of that information is completely wrong, but I think sometimes the dosing it comes up with is not appropriate. I think it's easy, but it's not what's best for the patient. I think um, the best results for the patient come from that really personalized approach that can be a little more difficult to scale, right? These computer programs, very easy to scale, but like sitting with the patient, listening to them, taking their case, interpreting their labs, prescribing them treatment, following up with their treatment, like that's a little harder to scale. So I think it does pose a business challenge for all of us once we become busy enough. How do we train other providers to practice like us? Or maybe we have nursing team that follows up with patient on certain intervals and then reduces load on the doctor. So that I think there's ways to get creative. There's lots of great companies out there offering training. I really like A4M. I think they do a really phenomenal job on longevity medicine, integrative medicine, and they're multidisciplinary. So they have, you're welcome to take those programs, whether you're, a doctor, advanced provider, nurse. So I think it might even be open to nutritionists. Like they're very inclusive, and the quality of education is excellent. Um, Institute for Functional Medicine is another one that's a little more lengthy of programs, and I think that the training is quite good. Some functional medicine lab companies also offer comprehensive training where you can learn, they'll teach you lab interpretation, and I think it's valuable, especially if you're going to be using that type of testing in your practice. A lot of
Mhm.
those programs are complementary. And that's a really great, affordable way to start, right? Even if we're looking at, hey, cortisol testing or salivary hormone testing, or maybe Dutch testing, which is urinary hormone metabolites. So there's different places providers can start. And it has to be a lifelong learning process, just like medicine is, right? Things
Yes.
change over time and we have to keep up to date. So if you decide you want to take on this additional specialty in your office, you're going to be constantly learning about the best practices for your patients.
Okay. Um, Dr. Chertel, can you also lean in onto this question and give your thoughts on it as well? Because I'm curious to hear what you think, and from your perspective, what may, like, the biggest challenges be for a new practice owner who's getting into integrative medicine.
Well, if you're doing real integrative personalized medicine, the biggest challenge I think is when it's personalized, there's very much an art to it as well. And it's difficult because you will have patients that are very committed to getting better, very committed to their plan. The plans are, specific to them. And it's difficult to have someone else answer things that may come up in between appointments. And so it is like there's a lot more care that you have to provide in between appointments at times. And there's a different level of expectation from people too when you are paying cash and you're in, looking to work with someone who specializes in this type of medicine. It's more personal. So be prepared to, have that time in that space if you're going to take on that side of medicine to deliver good care and be available to patients when they start on hormones and they're having some symptoms that they weren't expecting, you know, as they're adjusting. You need to make sure you have yourself and your staff set up to be able to respond and handle those things that come up, especially like in the first couple weeks of starting on them. And find a mentor too. I think there's lots of people out there that you can network with that would be more than willing to mentor. You know, you might think, oh, they just think I'm competition, but I've met amazing people that you might consider a competitor, that we are, you know, we support each other and we mentor each other, because ultimately it's about the patient. And then, you know, it's good to have people that you can count on, because when you need something or they need something, you can help them and they can help you. And, you know, it's not the best to go alone and share knowledge with each other. So yeah, finding a mentor. But yeah, as far as challenge, I think there's that aspect. I think it's important to have, like, if you're starting out, to have maybe like more streamlined programs, like a metabolic reset for 30 days, or like a detox program to, you know, to cleanse the liver before they start on hormones. You could do like a holistic acne program or something like that, where you're looking at the gut too. So like, but more streamlined programs, I think, work well. And, you know, ones where you can teach group classes maybe once a week for 6 weeks in a row and maximize your time that way. Where, you know, you're not doing like 30 to an hour appointments if you still want to do aesthetics too. So like, programs I think are good, and keeping it narrow and standardized would be my advice, especially like if you want to do a lot of aesthetics in the practice too, and not have it get where you have to hire a lot of staff to support that side of it.
Right.
Does that make sense?
Absolutely, that makes sense. And I was just thinking, you know, there's so much personalization that goes on to this, right? As compared to just like, you know, doing aesthetic treatments, though there is a lot of personalization there as well. But just this integrative medicine aspect of things, you're looking at just, you just mentioned 30-day programs, and then there are like 6 months programs where you constantly follow up and have these sessions, right? I'm just, and you mentioned a fantastic point about maximizing your time. So perhaps like that's a whole topic in itself, right? Where you have to really think about how you're going to maximize your time, since a lot of these personalization sessions are uh, a long period of time kind of treatment, right? With that in mind, I would love to segue on to our next question, which is about the maintaining of such a program, right? So, Dr. Nicole, for aesthetic providers looking to integrate wellness services such as hormone optimization or skin health programs, what advice would you give to do this effectively while maintaining that high quality care?
So yeah, I think maybe think about in the long term where you really want your practice to be. And if you feel that, you know, you want to be more like 50%, I'm 50% doing aesthetics and 50% of my time doing functional medicine consults. And I love both equally. So think about what you want and then design things accordingly. If you want to do 20%, or maybe you want to offer it in your clinic, but you don't want to be the one primarily doing those services, you, like Dr. Lawson said, you can bring in someone from the outside, and you can still offer those services to your patients, and they can focus on that full time and make sure that your, you know, patients get the best quality of care and the best attention that they need. We have I think teaching classes and education, you know, doing is a great way to value add to your clinic and teach people about health and build loyalty further. And then you can increase your, supplements that you put them on and, teach them outside of the aesthetics. If you're not doing the one-on-one consults with them, you can sort of teach them, hey, I didn't know that, collagen was made from these amino acids and vitamin C and zinc. I didn't know that at all. What else can you teach me? So yeah, I think also like handouts and educational materials are a great way to sort of introduce functional medicine and integrative medicine to these patients with just like little one-page tips on, what they can do, like quick little diet tips, supplement tips, and, just little teasers. But I think we already talked about, scope and flow and keeping those conversations at a dedicated time. But education and teaching, and you can even bring in like someone to do specific classes on eating to boost your microbiome, and have it I think just think ahead as far as where you see yourself in 10 years and how you want to be spending your time, and then try to design your practice from the beginning, either just doing programs or offering one-on-one based on how you want to spend your time in the future. Do you agree,
Okay.
Tanya?
Yeah, and so a couple things we do too to try to sort of introduce that idea besides the intake form is we give patients a cosmetic interest form. So what this is, just a really quick checklist that they do in the waiting room before they come in for an initial consult. And it will have, okay, yeah, like I have wrinkles, brown spots, they can check whatever aesthetic concerns they have. But then we have a wellness column. It's like, are you having like hot flashes, fatigue, sexual difficulties, weight gain, and they can check those too. So maybe they're coming in for like a facial aesthetic consultation, but then they've checked some of these wellness symptoms. So then that can become, oh, I noticed you checked this. Like, did you know we had A, B, and C here in the office that can address those concerns? We also give patients a handout that outlines their skincare. So when they come in for consultation, we do care consultation. And on that handout, we also have a supplement section. So sometimes it's like, okay, yeah, you need collagen or you need vitamin C, or, you're on oral contraceptives, you should be taking B vitamins, you're on omeprazole, you should be taking B12 and methylfolate. Like there's just so many opportunities to kind of add it on where it seems normal and like just a seamless part of the aesthetic experience. And I agree with Nicole. I think her idea is to kind of make it more manageable and scalable because, especially if you have a busy aesthetic practice, it can be really hard to find the time to fit it in. We do a membership model in our practice, so we don't do a fee for service model. So you come in, you're having your consultation, and now you automatically go in a 1-year program. And that program, includes a certain number of visits and whatnot, but that can be another way to sort of scale or decide like how many patients I can fit in my practice. I think Dawn is having some technical difficulties, but we can maybe do the last questions.
Sure, yeah.
Sure. So Dawn was going to ask about the field of integrative medicine and where we thought it was heading in the next few years, particularly with the rise of personalized medicine and preventative health trends. This is like food for my soul, seeing everyone wanting to do regenerative medicine, being preventative. As naturopathic doctors, that's the core of our training. Like prevention is the key. And that's why we spend so much time, even in our training and in our day-to-day, focusing on diet, lifestyle, stress management, because we want that not just that longevity, but we want that quality of life. I think all of us would agree if we live to 100, but like are in chronic pain every day and feel horrible every day, like who wants to live to be 100? But when we have that quality of life and that vitality, that's really, I think, where we're seeing aesthetics and integrative medicine head. So I predict more of a focus on longevity now, on cellular regeneration, reversing the body clock, reversing your age, your biological age, and offering therapies that actually help with that cellular regeneration and repair. So it's not just about, it's about slowing down aging, but then also reversing aging as well. And just really, feeling our best and that focus on quality of life. Dawn, I took your job and I read the last question because there were technical
Absolutely.
difficulties.
Yes, yes, and I really truly appreciate you for that. And I mean, I would love to hear Dr. Nicole's perspective on this as well, because this was a question that I was really keen on hearing both the sides. Dr. Nicole, can you also lead in?
So it's all about like adding years to your life and life to your years. And I completely agree with Tanya that it's been a journey, because her and I probably got into this around the same time. I've been in practice for 16 years, and I remember flying out to look at naturopathic medical schools, and people would say, "You're gonna be what?" And like, witch doctors. But now it's like, you mention it and they're like, "Oh my God, that's amazing," which is really kind of cool. But people have become more aware that there's things that they can do to change their biology. And we can now measure ways to see like what's your biological age and what's your telomere length. And we can actually make recommendations for patients and check it again and see that they have reversed their biological age. And when patients ask me, like, how did you get into aesthetics? I am like very much a naturopathic doctor in my mind. Like, I think about things in a very specific way. And what makes sense for me and what drew me to it was like when I realized with PRP, I could do an injection and regenerate collagen, work with the body's own ability to heal, giving it the right things. So I've always done that with the body physically, but when I realized I could do that with aesthetics too, and then I've had providers here who do that with the joints, that is what, like, I'm so, over time, I've gotten more passionate about that too, like the whole longevity side of things and how to improve your cellular health, to reverse different aspects of aging and to maximize your potential. Because all aging really is going to stem from like how healthy your cells are and, how your cell membranes are, and those influence the mitochondria, and that's going to power up your nucleus that makes all the proteins and everything and the signaling through the body. So when you start to think about like how much, and someone teaches you how much your nutrition and your lifestyle factors impact your cell health, and then shows you how much that influences the aging process and empowers you to realize you can reverse it and do something about it, that's what's so exciting right now, I think.
Dr. Nicole, just to follow up on that, why do you think it took us this long to really appreciate functional aesthetics, or rather functional medicine in aesthetics?
What I think is truly that for so many years, this side of medicine has been suppressed. And just because of technology, communication that has improved access to information, they can't, I sound a little conspiracy, but they can't stuff it anymore. Okay, so we can all educate ourselves, and basically the times are changing, and you either get on board or you get off. And I think that now we're past that tipping point where they're like, oh boy, we're gonna miss out. We better get involved in this, because this is the way the people have decided.
Yeah.
The
Yeah.
people have decided they're not going to be put on 10 medications and be told there's nothing you can do about it, you're just aging.
Yeah.
They're just getting smarter.
Absolutely. I love that. Just to follow up on that, what are some of the key indicators or feedback do you look at to measure the success of an integrative approach, both in terms of patient satisfaction and overall vitality? I think you,
This question is for me still, yeah?
yeah, yeah.
Okay, yeah, so if you're lucky and you have like a imaging device where you can look at those kind of metrics, that's wonderful. I mentioned you can do telomere testing if you want to get into longevity. That's like a simple place to start. Functional lab tests are fantastic because you will see those change. That, you know, you're looking for optimal ranges. You're going to get trained in optimal ranges, and you're going to see that patients feel better when certain markers are in certain ranges. And it's great to be able to be the first person to tell patients like, hey, you know, I know your testosterone's low, your vitamin D is really low. Vitamin D turns into testosterone. So a lot of men around here, you know, have low testosterone and they just need to take vitamin D and it will come back up. But you know, there's a lot of ways that you can measure progress through lab results, like seeing what their fasting insulin and glucose is, and their C-peptide, which might be coming back in range, but it's like, oh, it's double what it should be to keep your glucose at that level. You're having some, you know, glucose dysregulation going on, probably tied into your hormones, and we're going to improve that with, you know, supplements, berberine, whatever. And then that's going to help their aging process too. So we do use a lot of labs in our practice. And now there's so many technologies where you can really measure changes in the skin that are subtle, like hidden wrinkles and pigment underneath the skin. And people love things that you can show them. You know, a lot of times in my practice, I don't make a lot of recommendations until I see the labs. And then I explain to patients what the labs mean and what the supplement does to address the labs, and they're very compliant. If you just put people on a bunch of things and don't take the time to explain just the right amount of information so that they understand what's happening in their body and why it's important to take these things, they'll just be like, you know, take it for a couple weeks and then forget about it.
Absolutely. I think we are also reaching the top of the hour here. Just before we wrap things up, I would love to get some of your key takeaways. Dr. Tanya, how about we start with you? What is the one key takeaway our audience can take from this session here?
I think that patients want this, that this is the future of aesthetic medicine. So looking at ways that you can do this in your practice sustainably and in a way that's going to empower the patient, that's going to get them the best outcomes, that's going to get them feeling their best, which is going to in turn help them look their best. You know, this is the future of aesthetic medicine.
Absolutely. And Dr. Nicole?
I would say, you know, if you get into functional medicine or integrative naturopathic medicine, just, you know, do it because you are passionate about the results that you'll get for your patients and the quality of life changes that you can make for them. Do it because you're passionate and you have a burning desire to understand the body better and to help people feel better and look better, and you know, just be passionate about it and do it with integrity.
Okay, so you know, although this is the future, make sure you are passionate about it. Thank you very much for that. Absolutely wonderful session we had here this evening. Just going to share my screen one last time. So absolutely, an incredible hour. Thank you, Dr. Lawson. Thank you, Dr. Chattel, for sharing real-world insights on integrating wellness and aesthetics. I know you have given an amazing amount of information in this session here, benchmarks, specific treatments to start with. Those are just invaluable. And for our attendees, remember to claim your complimentary eco marketing strategy meeting. If your patients are searching online for the treatments you offer, make sure they find you. You'll also receive a short feedback survey. Please take a moment to share what resonated most with you tonight. And panelists, do hang back for just 2 minutes on the line as we wrap up. Just on behalf of the Business of Aesthetics, I'm Dan, Adisha, and thank you for joining us, and we'll see you next time.